What we're going to talk about today are using notes in your computer as part of your patient records in order to make appointment scheduling more efficient and make your office more profitable. So we're not going to talk about musical notes. We're going to talk about notes you use to manage your dental practice and manage your patients. In case you found this video on our website or on YouTube and don't know who we are Bruce Stevenson on the left, that's me, and Linda Piccinini on the right. I have been in dentistry almost 40 years, and Linda has been there over 30 years. And today, we are Today's Dental Consulting. I'm still a practicing dentist, and Linda is still my office manager. But we also do webinars, training, consulting, and make little videos like this. All right, let's talk about notes. I mentioned that you're going to use notes lots of places in your patient records, in your computerized patient records, and we'll come in a minute to paper records. Notes need to be signed so we know who did them. Now, I know everybody thinks they have a perfect memory and they remember they talked to Mrs. Jones on Monday the 21st at 2 o'clock in the afternoon and this is what was said. In peer review, there's an expression that if you didn't chart it, you didn't do it. And I think this is what we need to adopt for our note taking. If you didn't make a note about it, about that phone call or about that conversation, you didn't do it. So get in the habit of making good notes. God forbid you get run over by the school bus. Other people need to come along, regardless of how good your memory was until you got run over. Other people need to come along and figure out what happened with that patient. So that's a good reason to put notes in there. And as a matter of fact, if you've got a memory like mine, it's kind of handy to have your memory jogged a little bit by the contents of your note. So notes, all notes, have three parts. First of all, they need to be date stamped. Now, I know some computers automatically put a date in there, and I'll show you why that's not sufficient here in a few minutes. So we need to date stamp them. We need the body of the note, the content, and that needs to be clear and concise. We don't want to confuse people. We need to accurately but briefly describe what happened in that conversation with the patient. Then lastly, I already mentioned, you need to sign your notes. Now, if everybody in the office knows that your initials mean your name, in my case, Bruce A. Stevenson, BAS, that's okay. You can use those initials. You don't have to write out your full name. If you've got a temporary person or somebody that's on kind of shaky ground and maybe temporary and not know it, they probably should write their full name when they sign their notes. But the point is, there's three places there, the date stamp, the body, and the signature. All notes have to have all three. Now, what if you're not paperless? What if you still use paper charts? I know it's very difficult to get rid of those things. You just love to write information in there. The problem is then you can't find it. So this is a good time to switch some of the things that used to be in the paper chart into the computer. And that's what we're going to do with the notes. Even if everything else is in the paper chart, God forbid, we want to put our notes in the computer. And we want to put them in the ledger in the computer so they show up. Don't use something like Dentrix's office journal. In my opinion, that's a pretty worthless feature in Dentrix. I want to see those notes easily. And the best place to put them is in the ledger, and usually that information is automatically posted for you over in the computer chart. So we're going to put our notes in the computer ledger or the computer charts, and they're going to be duplicated in the other place. Much more efficient. Other people in the office can access these notes simultaneously. They don't have to go and pull a chart in order to schedule an appointment or to read what happened about the last appointment. So Open Dental has a very nice place for notes, and it actually generates a lot of notes automatically for you. In this case, an email. When you send the patient an email from within Open Dental, and it's a feature that's built into Open Dental, it automatically posts that email in the patient's chart or in the patient's ledger. Very convenient. You also can put your other notes in there. So this is pretty slick, and this is exactly where I want the notes to be in your office, in the computer. In the case of Dentrix, not quite as easy, you have to set up some procedures. In this case, we have a procedure called a T-call, which is a telephone call. We still have our notes. We had to put the date stamp in down there manually. In the case of Open Dental, you just have to right mouse click and you can date stamp it. So we put the date stamp in. We have the body of the email and we have my initials in there. We also, besides the T-call procedure, we also have a C-notes for a chart note procedure. So it depends on whether you're calling the patient or this is some other note in there. Here we are in Dentrix. It just shows that that note that I created in Ledger is automatically duplicated over here in the patient's chart. So that's good. And most software does that. Keep in mind that the patient has a right to read their records, whether they're electronic, in the computer, or on paper. And I find most of the time when patients want access to their records, it's because they're upset. If the patient then reads some derogatory, subjective comment in their chart about themselves, they're going to be even more pissed off. So the point here is keep your charting factual. Okay? Don't just go on and on and on about how upset the patient was and ranting and raving and blah, blah, blah. That does not belong in your notes. Just the facts, just like Jack Webb down there in Dragnet. Just the facts. Leave out your personal opinions. Also keep in mind that whatever you write in the paper chart or the computer chart may end up in court. And even if you don't work in that office anymore, you may be called to testify and read your notes in court. So, gee, I would like to have my notes be very accurate and very objective, especially when the prosecuting attorney is asking you difficult questions. So this is kind of something to keep in mind about all your charting, not just your notes. So here's our three parts. We pointed those out before. The date stamp, the body of the note, and the initials to sign it. All right, where are we using notes besides the patient chart? Okay, that's one good place. But we have other notes other places too. We're going to talk about the ASAP list in just a minute, but you see there's notes up there in the upper box about the calls regarding the ASAP appointment. Down below, you see the appointment screen. So this is the screen that's tied to the appointment in the appointment book or in the unscheduled list. And you can see we have multiple entries down there. Each one is date stamped. These are different things that happen, different conversations that happened with the patient by different people regarding this single appointment. That's why, depending upon the date stamp or the date that shows up when you post a procedure, is not sufficient. You have to date stamp each one of these notes so we know who made them, when they made them, and we need to know what happened. All right, let's come back to the ASAP list. You have to set up the ASAP list properly in order to use it. Now, the ASAP list is a list of people, patients, who have appointments, but would like to come in sooner if something becomes available. Now, you set this up by asking the patient when you schedule the appointment, if I get a sooner appointment, don't say cancellation, if I get a sooner appointment, would you like me to call you? And then don't forget the magic words that you should be using 100 times a day. Are there days of the week or times of the day that are best for you? Okay, make it in the patient's advantage. Okay, so the patient can only come in on Thursday afternoons or whenever it is. That needs to be in your note that's attached to this ASAP list. When you call the patient to offer them an appointment, again, you need to date stamp it, you need to write a concise summary of what transpired with the patient, and you need to sign the note, because other people are going to look at this. How about the unscheduled treatment list? So the ASAP list is a great way to fill your appointment book, but you have to fill the ASAP list first, and you have to do it with good verbal skills. Same is true with your unscheduled list. The unscheduled list is a list of appointments which were initially made by the patient, but were then canceled at some later point for some reason. All right, so here's our notes. Excuse me, here's our notes regarding these appointments that were changed or canceled or moved or whatever was done. And these are people who no longer have these appointments. All right, we want to call those people. That's a lot of good treatment out there. But in order to do it and know what we're talking about, we have to know what happened about this appointment, who else has talked to them about this appointment, and what the patient said. That's the purpose of our good notes in the unscheduled list. All right, this was a lead-in. This little video is a lead-in to the next video, which is about filling the appointment book. We talked a little bit about some of the things, but you cannot effectively work an appointment schedule if you don't have good notes in there. It's just too hard. All right, so now be sure and watch the upcoming video, which is going to be about filling the appointment book, basically using notes and using some other things as well. All right, I hope this was useful, and I'll see you in the next video.